Welcome to HUD Midwest Matters. I'm Joe Galvan, HUD Regional Administrator overseeing the 6 states of Illinois, Indiana, Michigan, Minnesota, Ohio, and Wisconsin. I'll be your host for this series of conversations that highlight both the initiatives of Secretary Ben Carson and some of the best practices that we're seeing throughout the Midwest region from our partners and collaborators. Joining us today, we have a distinguished guest and my good friend, the Midwest Regional Administrator for FEMA, James Joseph. He is a colleague and fellow presidential appointee. Prior to joining FEMA, he had been appointed by the governor to serve as director of the Illinois Emergency Management Agency, IEMA, and as the Deputy State Homeland Security Advisor. In these roles, he oversaw Illinois' disaster preparedness and response, nuclear safety, and homeland security programs, as well as the agency's 200-plus employees and a budget of nearly $500 million. He also served on numerous national organizations, including co-chairman of the National Homeland Security Consortium, executive board of the National Emergency Management Association, and the U.S. Department of Homeland Security State and Local Intelligence Executive Council. James has over 15 years of senior leadership experience in both the private and public sectors, and we truly are lucky to have him here at the helm in FEMA under these current circumstances. Welcome, James.
Mr. Administrator, thank you so much for having me and glad to be with you.
So, James, I said a little bit about your background. Can you tell us a little bit more about yourself and how your personal and professional background influenced your career and the work that you're doing today at FEMA?
Absolutely. I think there's a couple of things, not just the jobs I've done, but also the way I was raised. I grew up with there's a family of 6, 3 other siblings and my parents, and my father is in service as a minister. He's the pastor of a church. He actually founded the first Indian Christian church in the city of Chicago. Some 45 years later, he still serves as the senior pastor of that church. And as a child, always doing more for others than doing for yourself is something that was instilled in myself and my brother and my 2 sisters. My mom was a nurse in the government at the VA. Both of my sisters have followed. They're both physicians at the VA. My brother is also the associate pastor at my dad's church, and I have the opportunity to serve here in FEMA. And I've worked in the private sector. I worked for 10 years in the private sector before joining government service. I worked as a county emergency manager, a state emergency manager, and now here with FEMA. And all of those experiences together, not just my professional experience, but the life experiences as well, and the way I was raised by my parents, it just flows right into what we're doing, being able to help people before, during, and after disasters.
Yeah, great story. It's our parents that form us, and I always say, being a housing guy, I always say it's the foundation that they put in, a strong foundation that allows us to do things. We choose public service because we want to make a difference. We're given the God-given talents and the blessings, and it's good to see you in that role. So, you're welcome. You obviously have a tremendous depth and breadth of experience in emergency management. So, The things that we're facing today, how different are they than any other scenarios that you faced in the past?
They're very different, Joe. This is truly unprecedented. Never before has our entire nation been impacted by the same event. I've worked some very complex events, severe flooding, tornadoes. I've had the opportunity over the last 2 years to support a hurricane response that's happened in other parts of our country. Even wildfires that we've seen, they're very specifically located to a certain geographic area. And much of America watches those events unfold on TV from the safety of their own home, the safety of their own community. Much of America is not having to shelter in place or alter their way of life. But with COVID-19 response, all 50 states, all of our territories, the District of Columbia, 571 tribal nations, all simultaneously are under a major presidential disaster declaration. Never before has that happened, and never before has there been so great a need for personal protective equipment, testing supplies, hospital capacity, healthcare workers, and being at the ground level of the federal response has been amazing. Working with other federal partners, the Army Corps of Engineers to build out alternate care sites for hospital overflow, working with the GSA to identify warehousing and locations, working with the Department of Agriculture, and even, Joe, some of the conversations you and I have had as we talk about sheltering and non-congregate sheltering in these unique environments. It truly has been very different. But the good thing is, a lot of the communication between us and the states have existed for years. We have been planning together and training together for various types of emergencies and disasters. And that has allowed our response in this COVID-19 situation to be that much more seamless from a communication perspective.
James, you're absolutely right. And one of the things that struck me is the Chicago Federal Executive Board. I had the opportunity to listen to you and other presenters the other day talking about what you're doing, how things are happening. And then you hightailed it out to Wisconsin. And the federal government, we're all in this together. We're all bringing different things, briefings at both the national level, gubernatorial briefings. We hear a lot about Region 5, what your team is doing. And I want to just echo the sentiment that we are thankful for your team being on the ground. Can you share with us some of the best practices and innovations you've seen across the Midwest?
Absolutely. I think we have heard so much about data, utilizing the data to drive the decisions that we're making, utilizing the data as governors look at establishing their own individual reopening plans, but also really utilizing that data to adjudicate resources. We have exercised and planned and trained over the years on, if there is a large-scale event that impacts multiple states, or in this situation is impacting every state, every territory, every tribal nation, how is it that we will adjudicate data? So being able to have data at our fingertips on a daily basis is very important. Joe, the first thing I look at when I come into the office, and now 99% of the team here at FEMA are teleworking. We're operating in an environment where we're doing this disaster response from home, but I have a handful of people here from our front office. There's about 5 or 6 people here on a daily basis. The very first thing that they place on my desk every morning is data across all 6 of our states. How many tests have been conducted? How many positive cases do we have? But not only positive cases, what is the hospitalization? Of those that are hospitalized, how many are in the ICU? And even still, of those that are in the ICU, how many are on a ventilator? That is critical data that allows me to understand how much personal protective equipment hospitals, nursing homes in the states are burning through on a daily basis. It helps me understand if I need to increase the hospital capacity through some of the alternate care sites that we've been constructing around the region and around the nation. And it also helps me understand if there are more critical care patients dealing with COVID or even a non-COVID event, are there federal resources such as ventilators that we need to be providing? So being able to take that data, use it, synthesize it very quickly, and make it actionable has been an amazing thing that we've seen. as well as the collaboration and cooperation with all of our federal partners. Joe, there's not a single thing, and I appreciate you thanking FEMA, but there's not a single thing that I can do on my own. Without a partnership, nothing would be possible. So working with partners from all over the federal government, the Health and Human Services Regional Director, Doug O'Brien, he relocated to FEMA. He moved into FEMA at the end of March, and he's been here daily working alongside us as well, and some of his team. And that has been instrumental. I understand emergency management and logistics. He understands the clinical side of things from the health perspective. Putting those two very important pieces together is how together HHS, ASPR, and FEMA are leading this event.
Yeah, you're absolutely right. I have never seen cooperation, partnership, information sharing like this before. And I've worked in federal government and federal space prior, so this is all good. Last question for you. What advice do you have for our fellow Americans and key stakeholders as we come together and rise to the occasion?
I think the most important thing is that we continue to stay together. We continue to work together. When you've seen significant responses as it relates to hurricanes or tornadoes, other natural disasters, or even man-made events, you've heard the term, it's the whole of government. Not just the federal government, not just state government, not just local government. The whole of government always comes together to help communities recover. But in this type of healthcare crisis, this pandemic that we're facing, Joe, it requires the whole of America. Every individual citizen has to do their part. The fact that we're, for a majority of the workforce is teleworking, stay-at-home orders, that has allowed us to mitigate the rise of COVID cases. If there was no mitigation, Illinois alone could probably have hundreds of thousands of COVID positive cases right now. So we see that mitigation is working. We see that it's effective. So every individual needs to continue to do their part. When you're out in public, wear a cloth face covering. Don't gather in large crowds. Continue to practice social distancing. Wash your hands frequently. Some of the typical things that we hear from our health officials during the common flu season. If we are smart, if we are work together, and we continue to support each other, that is how we as a nation will be able to come through COVID-19.
Well, hey, you're spot on. Words of encouragement, words of advice, sage good words. James, I just want to thank you and your team for everything you do for our region, our nation. And I always say, God places the right people in the right locations, and you, sir, are a blessing to all of us. So thank you so much for joining us.
Well, Joe, thank you. Thank you for your partnership. You've answered the phone every time I've called over the last couple of weeks with questions, COVID-related and not. I'm a true believer that God places us in positions and He strengthens us to do that. It is by prayer every day that I come to work, and I pray throughout the day. There's a lot of devastation, a lot of death, and we need to continue to remember ourselves and each other in prayer. I believe that's the only way we'll make it through this situation.
Amen to that, James. And James, what's the website they can go for more information on FEMA?
Yeah, if they visit FEMA.gov, anyone visits FEMA.gov, there's a wealth of information. There is a specific coronavirus page. That's where we're sharing all of our facts, all of our figures, and including a rumor control page. There's a lot of myths and rumors that have been out there, and there's a great resource for everyone on FEMA.gov on the coronavirus page.
Well, thank you, James, once again. This has been one of our best shows, most informative shows, and we look forward to working together as in partnership. So for all of you who are tuning into HUD Midwest Matters, please tune into our next show. We're going to have these episodes on the YouTube channel, and until then, we'll see you next time.